Good afternoon, everyone.
Yeah, welcome, Dr. Stuti. Can we start the webinar? Welcome, everyone.
Yeah, I'll just share my screen.
Okay, fine.
Is my screen visible, sir?
Yes. Perfect.
So, hello, everyone. Today we are going about a brief introduction about facial aesthetics. So, in that facial aesthetics, first we should know about the skin. What is aging and anti-aging, clinical treatments, what are the do's and don'ts, and facial aesthetics, what and why. So, when we go for the skin, there should be analysis of skin. It can be in 3 points: look, touch, and question kind of thing. So, first you ask to the patient, and then you touch and feel. So, patient has that rapport with you. And then questioning, has patient done before any treatment, or had anyone under treatment, or using any products. So, this is basically a overview or a layout of your skin structure, in which you have the epidermis, the topmost layer, then the dermis, and the submost layer would be hypodermis. So major part we are dealing would be epidermis and dermis only. Just a second. Error. Till my PPT starts, I give you a brief. So basically, we have two kinds of facial aesthetics divided into.
Sorry, the screen is not visible. Can you please share?
Sir, my PowerPoint is restarting, so that's why I was taking orally.
Fine, fine. Okay, go ahead. Fine.
So facial aesthetics basically is divided into two portions: basic and advanced. So one does not know basics about it, it's useless to learn about the advanced. So in advanced, there are only Botox, fillers, and lasers, and those who are interested can have thread lifts. Apart from that, everything is covered into your basic part. So for the look part, as I said in the earlier slide, the skin would be done in three things: look, touch, and questioning. So look can be by the magnifying light, or you can say that magnifying glass. And nowadays we have a machine dermoscope also. So you can take that also by touch with the fingers. So you can have the muscle elasticity, tone, skin tone, the aging part, anti-aging part, everything you can feel of the patient's face. The questioning, then what are their skin routine types, products they are using, and finally, if they have any problems with their skin which they want to get improved. So these are the list of questions you can ask to your clients. So see, in facial aesthetics, we do not mention as patients as we do in any other branch of medical. In facial aesthetics, we correspond to our patients as clients. So it is vital that we assess the skin correctly, otherwise incorrect products and pressure by us to the client would be very harmful and it would be ineffective. So your client would not turn up to you again, and there wouldn't be a positive feedback about you in your nearing areas. So this is basically a skin analysis chart. What you have to visualize. So first from the forehead, you can see about the open pores, papules, expression lines, and sometimes there are acne also if the patient has dandruff in their hair. So then you can come to the eye area. There are milia. Milia are basically small white lesions on around the eye, and dark circles are very common. So then comes the nose. So comedons basically whiteheads or blackheads, broken capillaries if any seen. Then you can see the cheeks or the side of the face. Then comes the chin and neck. So this complete analysis you have to do when a client enters to your clinic. So it's not you have to ask for each and every site, but you can visually notice the changes which have been done, and then you can counter back to the client. So they might not know about the milia around the eye, so you can guide about them. But if you straight away ask them कि ये आपके आँख के पास क्या है, they might not be knowing it, or they are not very concerned about it. So don't put a direct question to your client ever. Then in the analysis chart, we can see the muscle tone, texture, elasticity, and the skin type. So skin type basically would be normal, oily, dry, or a combination. So what actual facial aesthetics is? It is never too early to age elegantly. So aging is such a process, we cannot stop it, we cannot reverse it, but we can hold on. So there comes the benefits of facial aesthetics. So it helps in improving the appearance of skin, balancing out the problems of skin, deep cleansing, muscle tone improvements, speed up cell renewal, soft skin अगर होती है तो उसमें से dead skin cells हम निकाल सकते हैं. So that would be a relaxation and pampering session to your client, and encourage the client to look after their skin at home. Then comes up, these were all about the aspects of your client. Now what we as a doctor need to learn. So first of all, we should maintain the healthy safety and hygienic procedures at our area. Correctly prepare for the treatment. So अगर आपको peels करना है तो वहाँ पे सिर्फ peel का arrangement होना चाहिए. Rather than keeping 2 to 3 options in your mind, you won't be confident enough and you cannot deliver a good result to your client. So consultation procedures, first to explain the treatment options, treatment plan to the patient, have a consent, take photographs, and then the treatment would start. What are the contraindications and side effects if any patient can have regarding it? You must mention it. They must be knowing and they should be aware of it, and proper home care regime like cleanser, toners, moisturizers. If any, we are advising them, they should follow that. Sunscreen protocols we are not following in India. Not much people are following, but these days, because of facial aesthetics, people have started using it. So you have to recognize the skin type correctly for use of proper products. Aftercare and contraindication advice should be there. So for that, you must be aware of the anatomy and physiology of the skin, muscles, bone, blood, and lymph. So this should be learned on our part. So for the skin types, we have oily, dry, normal, combination, or acne prone. So skin conditions would be dehydrated, hyperpigmentation. Hyperpigmentation is nowadays very common. Melasma you can oftenly seen. Then aging skin, which would be loss of elasticity, wrinkles, skin sagging, and sun damage. As I said, because earlier people were not very keen to use sunscreen. So this way you can understand the skin types and skin conditions. And then we can advise them the cleansers, mask, which we can use during our treatment and which they can use after the post care treatment. Masks, basically we have three options: clay, cream, and gel base. So according to the skin type you can prescribe them. Then comes the exfoliants, which are on our part basically. So microdermabrasion is one of our treatments we can give to the patient. Then we have different machines like hydrofacial and dermapen also, and the chemical peels. Additional skincare products, sometimes patient may ask, can I use toner, astringents, or moisturizer if they have extremely dry skin or during winter season as currently it is going on. We can advise them. For oily skin, the moisturizer should be of oil free and should be taken in only small amount. So these are the small instructions which we have to give to the client. Otherwise, they won't know and they will continue their regime which they were using earlier. So aging is out of our control. How you handle it though is in our hands. So we can guide the clients accordingly. See, aging we cannot stop or reverse, but still we can control that to some extent. So facial aesthetics basically would be covered by two areas: Botox and fillers. As we all know, were knowing earlier, but nowadays there are different treatments. So for the facial aesthetics with Botox and fillers, you can correct frown lines, crow's feet, bunny lines can be created on the nose with the addition of fillers, and they have a sharp nose. Eyebrow lift can be done. Top lip lines, if they have a very deep groove over nose area, they can be fulfilled by fillers. Chin area, if they want their jawline or chin to be prominent, they can be done with the help of a filler. Necklines, if they have very prominent necklines, they can be relaxed with the help of a Botox. So Botox is currently used by young people too as a preventive measure. So if you have started seeing the wrinkles around your face, you can still add Botox to your own regime. And these injections are completely safe, and procedure does not take more than 15 to 20 minutes. It's just the numbing time which is more than your procedure time. So all complications would be informed in prior, and within seconds of administration of the Botox you can see the wrinkles are gone. But the only thing with the Botox is that it is transient, so it will have only 4 to 6 months. Then comes the lip and cheek fillers. So those are voluptuous lips. So volumized when we need. जब किसी को कुछ भरा भरा चीज चाहिए, तब fillers का काम start होता है. So thinner lips are lips and lines. Saggy cheeks हैं, fuller lips चाहिए, firmer tone चाहिए. Then we can add on fillers. So depending on the volume required, we will keep on adding the dermal filler. So it is safe because it is made up of hyaluronic acid, which is one of our own ingredient in the body itself, present itself. So when that ingredient is lost or the quantity is decreased, we need the requirement of fillers. So after the injection, the gel binds with the water in the skin to give volume to the skin, and it may last from about 6 months to 9 months to a year, depending on how the patient is taking their care. So these are the Botox and fillers. So majorly Botox would treat your upper one third, prevents the formation of fine lines and wrinkles, and can be used for excessive sweating and migraines even. So hand and legs, if someone is having hyperhidrosis, the terminology is hyperhidrosis, it can be cured, and in dentistry it can be used for the masseter hypertrophy. So the results would last up to 5 months depending. And fillers to use to shape and lift full face. An improvement can be seen as little as 1 to 2 5. So Botox and fillers have instant chair results whenever you inject. Then come the other treatments, chemical peels, glycolic, salicylic, lactic combination. Then comes your lasers, Q-switch, ND-YAG, CO2 lasers, IPL, hydrofacial, microdermabrasion, blood derivatives which are PRP and PRF, semi-permanent and permanent makeup, moles and wart removal, RF cautery, then your double chin treatment. There are a lot of things in facial aesthetics which could be administered and that can be started. So we'll see shortly about all of them. So basically chemical peel, what it does, it takes away your imperfections. So lighten the unwanted pigment and even out your skin tone, diminish fine lines and wrinkles to some extent, brighten and smoothen out rough skin, increase collagen and elastin, lightening acne, blemishes, and prevent future breakouts. So you can see each and everything can be countered by peel. But peel has to be done into a session. So single sitting would give only 15 to 20% result. Then comes your PRP. So it is through your blood. We will withdraw the client's blood approximately 10 to 20 ml. Then we can centrifuge it, or you can have a tie-up with the nearby pathology lab. And then after centrifugation, the platelets would be separated, and it would be at middle above the red blood cells. So you can inject them with the insulin syringe or the derma pen to the desired area, and the client can have the results. PRF, it is an advanced version of PRP basically. So collected from patient's blood, no anticoagulants, no byproducts, no immunological reactions. So improved patient satisfaction and low cost definitely. So there is no side effect at all. Then comes your lasers. So it can be of CO2 lasers or diode lasers for the hair removals. Diode lasers have been different from the range 808, 755, 1064 nanometer. These are the wavelengths used for the diode lasers. And CO2 fractional lasers can be cutting, fractional vaginal treatment, vaginal tightening. So depending on the purpose, you can take the CO2 lasers. So fractional CO2 would have a skin rejuvenation and scar removal. Normal CO2 laser for surgery operation, and along with the vaginal treatment, it would give you vaginal tightening. Then the most common and most known thing, hydrofacial. So it would have fine lines, wrinkles, elasticity improvement, firmness, skin tone evenness, vibrancy, skin texture, brown spots, oily congested skin, enlarged pores, advanced signs of aging. So all things can be compensated by hydrofacial. So this from hydrofacial, you can deliver the results instantly if you have taken a pre-op and post-op picture. So that is must for each and every treatment of your facial aesthetics. So patient can visibly see the difference once you have done the treatment. So now what about the do's and don'ts? So consent forms are must because without consent forms, see in India there is no suing option, but when you are in fault and you don't have consent form, there is no one to cure you because verbal communications are not valid in the law in your courtroom. So only consent form would be your savior. Pictures, definitely from pictures you can tell, and that can be a savior कि sometimes patient says that कि मेरे को यहाँ पर
ये लो
निशान
आप ये
नहीं
खाओ
था, आपकी ट्रीटमेंट
ये
करी
काट के दे दूं मैं आपको ये वाला बहुत अच्छा है सबसे
So sometimes client says that कि मेरे को यहाँ पर कुछ मार्क नहीं था, मैंने आपसे ट्रीटमेंट करवाई इसलिए मुझे मार्क हो गया. But they are unaware of that because the skin tone has improved. They might be noticing that. So pictures can help that to notice them कि नहीं ये आपका पहले से ही था. It's just that your skin tone has improved. That's why you are noticing it. Proper consultation, history evaluation. If a patient is allergic to something and if you have not properly consulted or history has been taken correctly, patient would suffer. Unethical practice, definitely the things which should be discarded should not be reused. First and the foremost thing. Pre or post op instruction should be given properly. The product should be written down, penned down, okay, which should be used in daytime, which should be used in night time, how many times they should be used. All these instructions should be given properly. And proper instructions with side effects. Sometimes we do the procedure and then there can be a redness for 24 hours to 48 hours. Our client should not be using the face wash for first 24 to 48 hours. So this instructions, small instructions should be given to them so that at last the patient won't come to you with the side effects. And if at all the patient client comes with the side effects, you should know how to manage that. So don't get stressed out if someone comes with the redness or the swelling. It is part of your treatment as we do in dentistry or in any other medical field. It would be compensated, but you should be aware and you should be know about it. So thank you for your part in my journey. So anyone has any queries?
Yeah, that's a really nice presentation, Dr. Stuti. Anyone has any question, you can switch on your video and you can ask questions. Or without video also you can ask, and you can put it in the chat box also. Go ahead. Thank you so much, Dr. Stuti.
I have received one query asking, are these procedures safe? Yes, absolutely safe. And being a doctor, we can definitely perform it. The only thing is you should have a thorough knowledge. Without knowledge, with YouTube knowledge, you cannot perform, you cannot deliver the results. So the only foremost thing you should is, as we have the knowledge about it, you can definitely do any procedure in your clinical setting.
Yeah, one more question in the chat box.
Yeah. Can a BDS practice in India legally, or there is any specific qualification required? Yeah, BDS can do, because only hair transplant, a BDS or an MDS apart from oral surgeon cannot do. So that is the only mentioning in the DCI which we have received till now. And the other procedures in the facial aesthetics which we are doing, those are non-invasive. So we are not damaging or we are not harming anything. So that's why we can do that. Ma'am, what you want to know about PRP?
The growth factor, like normal PRP is
For the advanced versions, we have
yeah.
PRF and the growth factors vials or tubes already existing nowadays in our culture. And another thing is we have cocktails, ready-made prepared growth factors, which we directly need to inject on the scalp of a patient. So growth factors, vial or the tube, we have to add blood only for that and centrifuge 2 to 3 times to extract the growth factors completely from it. The Botox is a transient treatment and it can only and only help for your wrinkles. So someone has forehead wrinkles and eyes wrinkles around the eyes. So wrinkles basically करचली जो अपन बोलते हैं, वो अगर है तो वो हो सकता है. अगर आप डेंटिस्ट हो, आपको और कुछ नहीं ट्रीट करना है, so you can add on for mesoterm. Sometimes patient comes with the tightening of muscles around your cheek area, so there can be Botox. Botox can be done. Another Botox can be used is for excessive sweating. बहुत ज्यादा पसीना आता है हाथों पर और पैरों पर, सोल्स पर और पाम्स पर. So there we do by micro Botox treatment for compensating those sweat. See, for conducting courses, you should be pretty confident about yourself first, that you can deliver a good amount of knowledge to your students, then definitely you can conduct. If you have done number of patients and you are confident for yourself, then no one is going to say you anything for that. Any more questions?
Can conclude this session if we are not having any questions more. Can we organize more sessions, like small sessions, Dr. Stuti, like Botox and filler separate webinars of 30
Yes,
minutes?
sir, definitely. Currently, I'm having online and offline both courses with hands-on at my clinic in Ahmedabad. So I have divided into two portions, basic and advanced. In advanced, there would be Botox fillers and lasers. And in basic, else other than these three would be covered. So I'm having online and offline sessions for that. And apart from that, if we want to conduct a short webinar for that, we'll be doing short.
Okay, thank you. And you conduct online also? Online?
Yes, sir. Online, it would be only demo because hands-on cannot be conducted by the students.
Okay, fine.
For hands-on, if they can visit my clinic, definitely I'll be providing them the hands-on too.
Fine, sure. Okay, we can conclude.
Yes, sir. It was pleasure having you all here. So if any more queries, you can directly connect to me or you can post your queries to sir also later on. I'll be very pleasing to help you all and guide you all for your future endeavors.
Okay, fine. Thank you so much, everyone, and special thanks to today's mentor, Dr. Stuti Bajaj. We will share all the details, and the recorded video of this webinar will be shared on YouTube. So we will share all the links, and we will share all the details of the online webinars in future, as well as the courses by Dr. Stuti Bajaj. Thank you, everyone. Have a nice day. Have a happy Sunday. Bye-bye.
Thank you, sir. Thank you, students. Bye.